Hi, everybody. It's Dr. Chris. I am so glad you could join me here tonight. We are going to talk about essential oils for nerve support. So I've covered this month muscles, ligaments. I've covered, what else did I cover? Joints. So we're going to talk about nerves, and there is a little bit of overlap, so you may want to go back to my other broadcasts, and I will put all the links for you in the description, because I might just make a quick mention of some of the other oils and oil blends, because oils have so many constituents to them that they can act in different ways for different issues and different support. But our neuromusculoskeletal system is kind of interwoven, and the things that bother our system or the things that we want to support for our system, it's often interchangeably done because one thing affects the other. So if you find one thing that works, that's great. Sometimes it takes a little trial and error. And you know what? A little bonus right now. I'm going to show you how you can ask your body if it is the right oil for you at that particular time. This is really easy muscle testing. And so here's peppermint. I'm just going to grab that and I'm going to put it right here on my chest, and I'm going to try and take a deep breath. I can't really take a huge deep breath. So to me, that's a no. I'm asking yes or no. Do I need this oil right now? I could still put it on. It's not going to harm me. But if I have a particular thing I want to support, like for my nerves that I just asked, then let's try clove. So I got a big yes on that because I could take a deep breath. So if you ask yourself yes or no questions you already know, like, my name is Dr. Chris. Can I take a deep breath? Of course I can, because that's my name. If I said somebody else's name, I wouldn't be able to. So you can practice this way. All right, let's get right into it. Maybe I'll do another whole thing on muscle testing, but I find this extremely useful when I have a bunch of choices and I'm like, I don't know. But the oil that will work is usually the one that's in your hand or the one that you're drawn to. So you can try it first and see what happens. Now, the problem with nerve pain is it's really difficult to treat because of what happens in our body. Our nervous system has all these nerve accessory fibers so that we make sure that whatever that part of the body is it's going to, whether it's a muscle, an organ, or whatever, it wants to always make sure it has the right nerve supply. And our pain pathways, or nociceptive pathways, actually are run in different parts of the spine. I'm not going to get into all the anatomy, physiology, and all this stuff, but it can often be unrelenting. It's not as easy sometimes as muscular pain or joint pain, just because of this different pathway effect, and also that the body always seems to want to make sure that it has that connection, and those pain fibers seem to be more plentiful. So it can often really reduce the quality of life if you have pain going on. I don't know about you, but a lot of times I can handle things during the day, but I go to lay down at night and it's like, oh my gosh, it's just bugging the heck out of me. So there's not a lot of medical treatment options or pain relievers that are available as prescription because it's such a hard thing to deal with. I'm not saying people can't use medication or shouldn't. I'm just saying because of this quality of the pain, it's sometimes very difficult even if you are using a medication. And if you're already working with a doctor, great, because then they can help guide you. But if you just have occasional nerve pain, maybe like, a toothache or something, or a teething baby, or if you've got, mild pain and you know exactly what happened, it was an injury, or you have a condition that you're working with a doctor, essential oils are a great thing to try just because there's not that whole issue with side effects and whatnot that can go on with medications. Why? It's because it can work on all those aspects of health and through multiple mechanisms, just like it helps support the plant. Now, a little caveat here, if you're a Young Living member, hopefully you understand the difference in essential oils as far as being maybe a perfume grade oil or an oil that might be made synthetically versus a pure therapeutic grade oil. And the reason I'm stressing this is that all oils are not made the same. They're not all created the same. And so it really, really does matter. You have to do your due diligence to make sure that the oil you're using is of therapeutic quality, meaning it has the right constituents in the oil that I'm going to talk about in a bit, because if they're not there, then you're not going to have that effect. And if you go back to one of my earlier posts, or I think I talked about it in the Essential Oils 101, before I found out about Young Living, I was using other oils without any effect. And I just thought, I don't know what people are talking about because I don't see it. Now that I know better, I know that if you're not distilling oils for the right amount of time, you're not going to get those therapeutic qualities if that constituent is not allowed to come forward. So again, I don't want to go into too much detail, but it really, really makes a huge, huge difference. So if you want to talk to me more about it, just reach out to me. I'm going to put all my contact info in the description because it is so important. All right, so all the things that I'm talking about here, this is not intended to diagnose or treat diseases, okay? That's not what we're here for. This is just information to learn about how these essential oils can support your natural body processes and just for occasional and minor issues that you are having. So please, please consult your doctor if you're having severe, persistent, or chronic nerve pain, because it can be a symptom or a message from your body that you have something big going on. Promise me that. And this is because I'm just going to throw out a few terms. Again, you're going to hear these terms sometimes. Neuropathy, it's a general term. Neuro meaning nerves, opathy meaning there's something going on with your nerves. It's a general condition that's a result of nerve damage. Okay, so usually people who have diabetes, sometimes they might get something called peripheral neuropathy, where like they can't feel their feet. So this is very common in people with diabetes. So if you are having these major issues, please be working with a doctor as you're working with your oils. Peripheral neuropathy will typically affect the hands and feet. It can cause pain, numbness, tingling. And research is actually suggesting that some of these essential oils can help reduce pain resulting from inflammation and nerve damage. A lot of the studies are done on animal models and individual case studies of people who have been helped. So I'm going to put all the research in the description. You can have a look at that so that, you know, I'm not just making this stuff up. They're actually doing research with these either oils or constituents that are found in the oils. Neuritis, when you see itis, it just means inflammation. Okay, it's a general term we use. And neur, again, is the nervous system. So inflammation of the nerves, usually in this case, we're talking about peripheral nerves. And that could mean you've got pain or burning, numbness, tingling, even weakness. So just know that. And then people will throw around sciatica. They'll come into my office and say, I have sciatica. And then I'll ask them where their pain is. And it's nowhere near the sciatic nerve, but that's okay. It's just a medical term. It's not a diagnosis, and it just pertains to the signs and symptoms people have involving when the sciatic nerve is irritated. And that's the one that comes off in the low back, goes down the butt, and goes down the back of the leg. It's one of the longest nerves in the body. So sometimes people will have irritation or pain or numbness or tingling along with that. Again, with the nerve, it just really depends on what's going on with it. All right. So we got those terms out of the way. Again, not that we're treating them, but just in case you happen to see these things or you've been told you have these things, that you actually know what they are and that they're just not this random term that's being thrown around. The first essential oil I want to talk about is ginger. And again, for those of you who are Young Living veterans, you know that when you see a white label, it means it's a vitality oil in the US. That means it's labeled for internal use. Is there a component that is a different color? I actually can't remember if ginger does or not, because some of the Young Living oils do also have a label. Like I know Clove has a white label, but it also has this brown label. And the colored labels are meant for aromatic or diffusing or topical use. So just remember, if I've got a clove oil in a white bottle and a clove oil in a brown bottle, they're the same oil inside, just labeled for different usage. All right, got that out of the way. So ginger, it has been found that it can help reduce neuropathic, nerve-pathic problems, basically pain from inflammatory conditions. And this was a 2014 study. It compared the effectiveness of Swedish massage using ginger oil, so topical applications, with traditional Thai massage in 140 older adults who had chronic lower back pain. And then although both treatments improved with symptoms, the Swedish massage with the aromatic ginger oil was more effective than just the Thai massage in reducing pain and disability. So ginger oil contains a compound called zindabane or zingabane. I'm not sure how you say that one. So you can look that up, but it basically possesses potent anti-inflammatory properties. So this is why it might help with pain in the nerves, right? So they still haven't investigated the use of ginger oil for specific treatments of neuropathic pain. But again, it might be something that you want to try. All right, chamomile. So Young Living has two different types of chamomiles. We have German chamomile, and right now I've got the Vitality. Hope you can read that. Sometimes the glare from my lovely eye lights. This came out nice. This is the Roman chamomile, and I believe, I can't remember if that has a vitality component or not. Too many things, guys. Sorry, can't remember it all. Anyways, as we know, chamomile is generally something that's acts like a sedative, very relaxing. And it has in it something called Borneol. It's a compound that's found in both chamomile and lavender. And that has been found to reduce pain and inflammation related to neuropathy. And this was a 2015 study that I will put a link to. They still haven't confirmed this in effect in humans, but it's going to require more study. But again, sometimes the best study, again, is trying it on yourself if you think that it could be helpful. Lavender, and I think, I forgot to grab my lavender. I think you guys know what that looks like. It came in your starter kit. Some studies suggest that inhaling lavender oil may help reduce pain and anxiety, and that's just in general. So there was a 2016 study. They did a type of procedure called a peripheral venous cannulation, which basically means they stuck a needle in a vein. It doesn't sound very fun. And in 106 people who were going through this procedure, they randomly assigned whether they were going to get the lavender or not. And following this procedure, those in the lavender group reported significantly less pain and anxiety than those in the placebo group. So again, it's just something to look at and consider. Like, why would these things work? I showed you peppermint, one of my favorite oils. You guys, it's also in the starter kit. So far we've talked about lavender in the starter kit. We've got peppermint in the starter kit. A single drop of pure, high quality peppermint oil has the equivalent of 29 cups of tea in concentration. Just let that sit for a minute. One single drop of peppermint. This is how concentrated this stuff is. It is the life force of the plant. It is the essence of the plant and of what gives the plant its properties and healing properties and how it is able to heal itself and nurture itself. So I just found that to be absolutely a mind-boggling description that you would have to have 29 cups of peppermint tea with the fresh or dried herb in order to get the same effect from one single drop of peppermint. Crazy. All right. So they found in 2002 that topical peppermint oil helped a 76-year-old woman treat neuralgia. So that's nerve pain. Algia means pain. This woman had been resistant to other standard therapies, but saw almost immediate relief after applying topical peppermint oil. And this relief lasted 4 to 6 hours after application. How amazing is that? And this is what I'm talking about. Nerve pain can be unrelenting. And this woman, she was trying other things. They weren't working, but the peppermint oil gave her at least some minor relief. 4 to 6 hours of relief, right? That can be huge. That's like a good night's sleep. So there's several ways you can use the peppermint oil. You can put it on topically, as this case study did. You can take a hot bath with it and put 3 to 5 drops of peppermint essential oil in the water. But I don't like to just drop it in my bath water, because then it just floats on top and then it's not going to get incorporated into the water. So mix it into Epsom salts, and that's going to incorporate more into the actual bath itself so it can get absorbed into your body. You can also directly massage it onto the area that's affected by putting it in some carrier oil. That could be almond oil, coconut oil, jojoba oil, olive oil, whatever oil you have around, V6, it doesn't matter, but that massage is certainly going to help, because even that tactile application has a positive therapeutic effect. Okay. Moving right along. And of course, if anybody out there wants to say hi, or if you have questions, just let me know, because we are live right now. Helichrysum. This one was a new oil to me. I'd never heard it before, and it is pretty amazing. It's got an interesting aroma to it. I actually really like it. It's a little bit sweet, but it's not sweet. I don't know how to describe it. You have to smell it. And let me just tell you, I had, again, before I had come in contact with Young Living, I was getting some Helichrysum oil for something. And if you cannot find pure Helichrysum out there on the market, it's going to be diluted in something. You're going to see like 10% Helichrysum. You cannot find pure Helichrysum. This is pure Helichrysum. And you can actually go to the Helichrysum farm in Croatia that Young Living has. And I cannot wait to go there. And I want you guys all to come with me to the farms, because they're amazing. I've only been to one so far, but my goal is to go to every single one of them. And so when you get Helichrysum from other places, who knows where it's coming from, because it's not grown a lot, and most of the time it is diluted in something, and I don't know. All I know is the stuff is amazing for skin and any healing that needs to go on. And the main constituent in Helichrysum is something called Neroli. It's also known as geraniol. And this is a monoterpene that has neuroprotective effects. Neuro meaning nerves, protective. So protects your nerves, protects your nervous system. It also, in a study, reduced the loss of dopamine-producing neurons in a mouse study. Dopamine is a neurotransmitter that's produced in the brain. And again, I don't want to get all into that, but basically you can see that this is also having an effect on the nervous system. And I will put that study in the description. So you can apply that topically and it can work wonders. Neroli essential oil has central and peripheral anti-nociceptive effects, which support its claims of use and management of pain and inflammation. I'm going to put that study in there. Anti meaning it is working against the nociceptive effects. Your nociceptors are your pain receptors. So it's having an effect on pain, basically. Also with inflammation, it's really good. Let me show you the Neroli. If you got, where did I put that? Oh, there it is. If you guys have not yet smelled Neroli or Neroli or however you want to say it, it is amazing. It is like standing in a field of orange blossoms. Oh my God. Oh, it's heavenly. It's absolutely heavenly. And, you know, all of the citrus oils have this effect of uplifting mood and spirits. So that's also going to have an effect on your emotions and therefore how your perception of pain is, which is a whole nother thing because pain is really in our brain, what we think about it and what we have attachment to it. This is a whole nother subject, but, you know, even just smelling that, it's just like, whew. So I like to put a drop of this on the top of my head. And it also helps me just be happy and keep focused. And it really lasts a long time. The chemical constituents in here do not evaporate. So I use sort of my hair as a diffuser. Oh, so it becomes like orange blossom hair. I love it. Okay, let's not get carried away. All right, clove. So I showed you clove. You guys, this stuff is amazing. I never in a million years thought how I would love clove, but I'm actually doing a sleep protocol where I put this on my sacrum every night. It is an essential oil that is rich in something called eugenol. Eventually, I'm going to go through all these constituents and make posts. I've already made one on Eucalyptus. If you have not seen it, I highly recommend you go to these things because it really then gives you a full understanding of the complexity and depth of these oils. But basically, compounds like eugenol have a potent antioxidant effect, which then can reduce damage in the body. From oxidation, so free radicals and basically air in our normal metabolic processes make something called free radicals. Well, clove has an antioxidant value, an ORAC value of 1 million. I believe it is the highest antioxidant value of all the essential oils. So when you are taking clove, and there is a clove vitality component, so it is something you can take internally. So we've got the topical and aromatic. You are taking in so much goodness that can help with repair of the body and damage and detoxification and all this stuff. And so that's including with some of these conditions I talked about that are creating neuritis and neuropathies, because all that inflammation is going to create damage. And so there's been studies around eugenol with this. It's also they've shown it's been able to reduce neuropathic pain, which is pain, there's something called allodynia, which is pain initiated by a non-painful stimulus. In other words, it wasn't the thing that started it in the first place. And something called hyperalgesia, meaning that you are more sensitive to pain following something that actually causes pain. So it's pretty interesting because this has been used topically for a long time. Moms have been using clove oil on their babies' gums when they're teething, very diluted. Okay, so it's strong, right? It's kind of spicy. So you have to be careful. You don't want to burn your sensitive oral tissue if you're using it for that. Put very little in a carrier oil. And what I always suggest to moms, if you're using it with your babies, is try it on yourself first. And you want to have it so dilute that you're going to barely be able to feel that spiciness, and that should be about right for your baby. But it's pretty crazy. Clove is in our thieves oil, which is in your starter kit. It's also in Panaway, which is in your starter kit. And what's even better with clove oil is that it has been found to really be useful for things like sciatica. So the research is still early on it, but it seems to be that it holds a lot of promise for people who are having sciatic issues. Of course, being a chiropractor, I'd be like, go and check your alignment as well, because there could be pressure on that nerve. And we want to try and get to the cause of things, not just use oils like we would use any medicines to medicate. We want to help support our natural body for what we have. So I'm always asking, what's the cause? What's the cause? And you want to do that. Why? What's the cause? And not just use even natural things as a way of mitigating pain, because you want to get to why that pain is there or what message it's telling you. All right. Copaiba or however you want to say it is pretty magical too. It supports the body's natural response to injury, irritation, and inflammation. It has the highest amount of beta caryophyllene, so the highest percentage of any of the other oils. And it may also be one of the more effective essential oils for nerve pain because of its neuroprotective effects and its analgesic properties. And this was all looked at in a research. Actually, there were 8 preclinical studies finding that Copaiba essential oils anti-inflammatory. So a lot of good stuff with that. I like to use Copaiba layered with a lot of these other oils that I talked about so that it works synergistically with them to make that oil work even better and maybe even bring it deeper into the body. And the body knows what it needs to do with it. So this is super great, super amazing. All right, I've got some honorable mentions. I'm not going to really talk about them that much because I've already done information on eucalyptus. It's warming, it's soothing. You can add it to your massage oil and whatnot. So I talked a little bit about layering or putting oils together because sometimes the mixture of essential oils is going to give more relief than using a single oil. And it's that alchemy of those different oils. So you might want to use a blend. And I love Young Living's blends because Gary definitely was the alchemy master. And even if I try to put the same oils together in the same amounts, it doesn't seem to be the same as when he blends them. So it's incredible what he has done. So you can use Young Living's essential oil blends like Panaway and Cool Azul and Deep Relief, Relieve It, Aromatherapy. There's so many of them. And if you go back to those other videos, I touch on all of them. Or you can try mixing your own oils together, which I've done as well, or putting them on one at a time and layering them, and it will all have different effects. And sometimes you just have to experiment. But there actually was a study where researchers gave a homeopathic topical oil to 60 participants with foot pain who had peripheral neuropathy. And the essential oils they put in were geranium, lavender, bergamot, tea tree, and eucalyptus. And 56 of these people who received this treatment reported a decrease in pain within 30 minutes. And of the people who didn't get the oils, only 26 of the 60 in that control group reported a similar decrease in pain. And I actually found this very surprising because I am also a homeopath. And to me, I thought essential oils might mitigate in a negative way the homeopathic response, just because homeopathy is an energetic treatment system. It's the law of similar, so like cures like. And I thought that the essential oils might compete with that or negate some of the effects of the homeopathy. But actually, the research had shown that the terpenes and the sesquiterpenes that were found in the essential oils enhance the skin permeation of the homeopathic remedy. So I thought that was super interesting. It's crazy. And, we're still all learning about what these oils do because they can do so many things based on their constituents. Other supplements to consider for nerve support would be Sulfurzyme, which I've talked about at length, and I'll put, again, those links in there. Super B. All your B vitamins are generally support for your nervous system. That would also mean that Master Formula would be good support because it has all the Bs in there. Omegize and Mindwise are also great because they are supporting the essential fats in their support our neurologic system and really every cell in the body. Okay, so remember, the Food and Drug Administration classes most essential oils as cosmetic products, which means that they're not regulating their quality and safety. Therefore, it really is up to you to look at what you're using. If you're using Young Living, you've got the seed to seal promise that you have the purest, most therapeutic plants on the planet. If you're using something else, it's up to you to do due diligence on where the oils are coming from. Where does that company get them from? Do they grow them, which nobody else has farms, their own farms, so they either have to get them from farms they co-opt or get them from a broker, unless they're growing them themselves, which then they're going to have a limited supply of each oil. So do your due diligence. You can use these oils in the diffuser, but most of the time for the nerve support, you're going to be either applying them topically or maybe using some of the vitality oils internally. Make sure if you're applying them topically, you use a carrier oil. It doesn't dilute it. It actually just spreads it evenly over the surface and actually sometimes can help with the absorption. If any of the oils cause any skin irritation, then you're going to just discontinue the use and put a little bit more carrier oil on top, which will, again, dilute that effect, especially if it's a hot oil. So always do a patch test the first time you use an oil. All right, that's it. I know this was a long one today. I didn't think it was going to go that long. So I thank you guys for bearing with me. I really value your time. I hope you got a lot of good information here. If you did, give me some thumbs up and like my post. You can share it with your friends, especially if you know they're having issues and need some nerve support, or maybe one of the other videos on muscle or joint. You can subscribe, which I do recommend because sometimes I will post impromptu videos, and that way you know when I do so that you won't miss anything. So I hope you have a great evening. If you're not a Young Living member already, you can contact me through my information that I'll put in the description, and I would be happy to just talk to you about why these oils are so different And I would love to know what your health goals and challenges are so that I can point you in the right direction so that you're going to have some good results in living above the wellness line. All right, everybody, I will see you next Tuesday at the very least. Have a great week and take care.